Eid grounds for the Eid prayers. Let's come back to the studio, shall we? Because every year, March 24th marks World Tuberculosis Day, a global initiative to raise awareness about TB and the efforts that are being made to eliminate it completely. Now, despite being a preventable and treatable disease, TB remains one of the world's deadliest infectious killers, affecting millions of people, particularly in low and middle income countries. Nigeria ranks among the top 10 countries with the highest TB burden. Many cases still go undiagnosed, fueling the spread of the disease. So, how can we increase awareness, improve prevention, and ensure more people get tested and treated on time?
We're going to tell. Thank you for joining. Joining us today to shed more light on this is, of course, we have in the studio here our doctor who will be giving us details about how TB spreads, what to do if you do think that you have it, and, of course, maybe a chance of whether it is, well, attendable by you at home or even at home.
Oh, yes, indeed. And we have Dr. Chukwu Ozioma. There we go. Hopefully I got it correctly.
Thank you very much for coming through, Dr. Chukwu.
There we go. Welcome.
So let's demystify tuberculosis. Ever since I was a child in primary school and I'm told about tuberculosis, they say it's a coughing thing, and then anybody who's coughing around you will run away from, That was being a kid. The older I got, I realized that it's a bit different from that. There's a unique way it spreads. There's a unique kind of cough and all of that. So demystify it for us. Is it curable? Is it not? Is it curable at home? Must you see a specialist? Please.
All right. So thank you very much for the question, and thank you once again for having me.
Thank you for coming on.
So demystifying tuberculosis is actually quite crucial, seeing that today is the World Day of Tuberculosis. And just as a way of introduction, TB is, we shorten it as TB, tuberculosis. Yeah. It's a chronic infectious condition. What do I mean by that? It's an infection that primarily affects the lungs. That's what we use, the breathing apparatus. It actually does affect almost every other part of the body, but the common presentation is what we call pulmonary TB. Pulmonary simply means the lungs. That's how it mostly presents, even though every single part of the body can be affected. The brain, the kidneys, the genitals, literally every single thing.
I never knew
affected.
this.
Yeah.
The genitals?
Everything.
Every single part of the body can be affected.
Does it affect or manifest on other organs? Because we always just thought it was just a lung thing, tracheal, and manifests in coughing.
Yeah. To understand that better, you need to understand how it spreads. Like I mentioned, it's important. That's the mode of spread. And also the risk factors. Who are the people that are at risk? Who are those that should watch out for this? So in terms of the risk factors, like you mentioned, Nigeria is one of the leading countries in the world. We're actually in the top 5, and we're actually leading in Africa because of our population. So, and one of the things that perpetuates that is the population, actually. So overcrowded. We have our prisons, congested slums. These are situations or conditions where the bacteria that causes the condition thrives and festers. Secondly is situations where there are children that don't
malnutrition.
People that have malnutrition. So because TB sorts of gains muscle, let me put it that way, when the immunity is low.
Right.
So any condition that tends to lower the body's immunity, the immune system, it's like an access code for TB to thrive. So how does it spread? Just the way I'm going to use COVID as a corollary.
Oh no!
So they are quite similar in their spread. So they spread through we call it droplets. That's droplets from the respiratory system. So people that cough, through secretions also. Okay. And it's also important to understand how it does not spread to reduce the stigma. So it's just like the cousin. I'll call it the cousin, HIV. It doesn't spread through touch. So you touching somebody that is infected doesn't predispose you to any infection. So that's important to know. Yeah.
Nigeria has one of the highest burden.
Yes, in the world.
In the world. Why is that?
Yeah, thank you for the question. I already mentioned part of that. The population, we're actually it's not about the population, it's about the density of the population. That's overcrowding.
Proximity between one person and the other.
Exactly.
So if you're living on the mainland, you're in trouble. So
how Judith?
No, that's not exactly it.
I was joking. Yeah.
But then there is a point there. She does make a point there regarding, living on the mainland means that you're living in congested areas. So that must mean that it would aid the spread.
Exactly. But typically we refer to prison conditions, slums.
And is that where we have most of these occurrences in Lagos or in Nigeria, the prisons?
It's difficult to say. There is really no data or statistics to support that. But it has been established that prison conditions, any condition that perpetuates overcrowding, is
So
a risk
boys
factor for
hostel,
TB.
sorry.
Oh,
Yeah,
today is not
that's-
yesterday. But then again,
That's
there
a
again is another
typical
point.
example,
Yeah.
actually.
Sorry.
Yeah, go ahead.
About it spreading, I wanted to ask one quick one. You said droplets, secretions. What about using utensils together with people who might have it?
Typically, no.
No.
It's not
How
been-
is that?
It's not been proven to. Like I mentioned, what spreads this condition? It's a bacteria. We'll call it, I don't want to go into the technical part of it.
Okay.
There's a name for the bacteria. We'll call it Mycobacterium tuberculosis.
Okay.
And there are conditions in which it survives. And those conditions have to be met for the transmission to occur. And the secretion where it survives is droplets, respiratory droplets. And we understand saliva is not a respiratory droplet.
Oh,
Yes,
so
it's-
saliva does not carry the microbacteria.
I would say sharing utensils has not been shown to cause transmission of TB.
Interesting.
At this point, I have to ask about symptoms,
Okay.
right? Because you say it's not just an issue of lungs as well. It's respiratory and it can affect the genitals. So what are, and when we hear tuberculosis, we hear, I don't have one. I don't have. But go ahead.
Yeah, in terms of the symptoms, most of the telltale symptoms that we see are actually respiratory. By the time you're having all those other symptoms in the other parts, then we understand that it has gone far, like it's spreading. Do you understand?
What could the other symptoms be?
So the symptoms, the classic symptoms of tuberculosis, we have cough, obviously. So, and the pattern of cough is important. We call it a chronic form of cough. Usually we use the borderline of 2 weeks. So when someone is coughing persistently, despite treatment, for greater than 2 weeks, then our suspicion for TB grows. Then we have to do further tests to find out. Then other common symptoms, night sweating, so profuse sweating at night, when there's no other explanation for it. We have weight loss that cannot be explained by other reasons, not like you're trying to lose weight or you're going to the gym. Then with an attendant loss of appetite. So those are the common symptoms that, of TB. Then we have the symptoms of the other forms of TB, but that's dependent on the organ that is being affected. Wow. So if you have the brain, you have all those other symptoms, loss of consciousness, dizziness, fainting, and all that. But that's like an advance when it's spread beyond the lungs.
And ultimately, what happens if left untreated?
If left untreated, it can actually kill. TB is one, in fact, like I mentioned, our statistics is not so robust, but last I checked, there's an estimate of roughly 250,000 people actually die from TB in Nigeria annually.
And it's all thanks to underdiagnosis.
And that's the data we have. I'm sure it's worse than that, but
Right.
based on the data we have.
Nigerian
that's
data.
it.
Wow.
I have to ask about from this point. I mean, when World Tuberculosis Day is not just spreading awareness, but it's also a time for the World Health Organization to want to set an agenda when it comes to reducing the number, especially for countries that are burdened with this disease. What are the challenges you see for Nigeria in adopting strategies currently to tackle tuberculosis?
The current challenges we face, and just to mention, you mentioned the World Health Organization. There are actually programs in place for early detection and treatment. We have the National Tuberculosis and Leprosy Control Program. I was privileged to be at a center in Kwara State back then, where that is totally geared towards screening and treatment of TB and leprosy. And currently, what the challenges will be is, first and foremost, is poor education. We have poor health education. People are not aware. People don't know what to look out for to raise their index of suspicion. We have extremely poor health-seeking behaviors. People would rather go to wherever before they come to the doctor. So by the time we are seeing some TB cases, it's already advanced. They've tried several herbal remedies, pharmaceutical remedies not recommended by a doctor,
Right.
and so on and so forth.
Do you think there's also stigma as well in that list? Or sort of stigmatization of...
Yeah, I would say, but because of the poor awareness, I would say the stigma is not so like some other conditions that we know,
Conditions
COVID,
everywhere,
HIV, and the likes.
Nice.
And just to mention, HIV is like a very close cousin of TB.
Yeah, you said that earlier,
Yes,
and I
yes.
found that very strange because I haven't heard that relationship.
Yes,
How exactly does that work?
In fact, one of the leading causes of death in HIV patients is
It's tuberculosis, yes.
Yeah.
Yes.
So, and
On its own, is it curable?
yes, tuberculosis is very curable. But, you know, it's important, the early detection thing is important and prompt treatment. But yes, there are medications to address it.
So once you have TB, can you treat it at home or must you see a specialist?
No, you have to see a medical doctor, preferably a specialist, like you said. That's a respiratory specialist.
A respiratory How does one even catch TB? No, I'm just, without coming in contact with somebody who has it, you know, how does one get it?
You can't get it without coming in contact with someone that has it.
So we don't know the origins. And that's the thing, right? Same with HIV. We don't know the origins.
Bacteria mutates, and then this happens and that happens.
Yeah.
Am I correct?
HIV is a virus, by the way.
Is a what?
It's a virus.
Virus, yeah.
That's why it's difficult.
Tuberculosis,
That's why it's
however,
difficult
is
to treat. Yeah, tuberculosis is a bacteria.
bacteria.
So we don't know the origins of this.
We have to go back in time and, you know, we really can't trace the origin, but I'm sure it dates back. Tuberculosis has been an issue since the days of the World Wars.
So let's talk about accessibility to testing for people who might think that they have tuberculosis, especially in areas that are far from urbanization or civilization.
Oh, yes.
How prevalent is it in civilizations like we talked about congestion and Lagos to places where it's not that congested? However, in these places, how accessible how accessible is it to get testing and treatment?
Yeah, so that's one of the bottlenecks of, you know, diagnosis and treatment. We have screening tests. What do I mean by screening? Just to check if the person does have it, but to confirm if the person does have TB. Only very few specialized labs have the capacity for the tests. So the screening test is a skin test that we do. We call it the tuberculosis skin test, or MANTO. So it's like a screening test that can be done like MS.
Does it manifest on your skin as well?
Yes, there are ways because it's an
That thing affects everywhere.
It's
Wow.
an
Brain,
hypersensitivity
genital.
infection. So there are ways we can check the reaction on the skin, but it's not exactly reliable.
So you were saying it's accessible in...
The skin tests are generally accessible even in low-income communities, villages and stuff. But the diagnostic test is quite, should I say, you know, a bit technical sort of.
Is it affordable anyway?
I wouldn't be sure.
Affordability is one. We got to talk about affordability.
Affordability is another thing.
We call it the gene expert. So, for instance, in Lagos, we have specific labs where we send for this test because not everyone does it. Do you understand? Because that's how we confirm the condition is there.
So that must mean it is rather pricey to get tested.
Exactly.
It is pricey to get tested. What about getting treatment? Is that... is it affordable treatment?
Yeah, to the best of my knowledge, I mentioned the National Tuberculosis and Leprosy Control Program. To the best of my knowledge, I don't know about the recent USAID fiasco, but TB has always been free to treat.
Oh,
yes.
but not free to test?
No, not free to test, to the best of my knowledge. But it's free to treat. Like, they have programs, just like HIV. Like I mentioned, up to the recent USAID fiasco, I'm not so sure of the current reality. But TB has always been, because I've worked in Benue State where some of these things are endemic, and I'm aware there are programs to provide free medications for these patients. We call it the DOTS program. Yeah.
Okay.
Wow. So Benue is endemic with it. I'm also thank you for taking out the time to come on, Dr. Ozioma, and also just for everyone, please make sure to take your preventive measures. Be careful if you feel any sort of way. Go get tested.
Oh, Judith, we forgot to ask. There are no vaccines for it, is there?
Yeah,
that's talking about prevention generally.
So there are vaccines?
There is a vaccine in childhood to prevent...
Childhood.
There's an aggressive form of childhood TB.
Okay.
We call it, I'm sure you must have heard BCG. I'm sure if you
Yes.
check your arm, you
Yes,
see
we
one.
have that one.
that's it.
Yeah.
1981, I don't have it.
I'm sure you do.
Weirdo.
No, I don't have it.
You do.
But yeah, I have
You
been
had to
vaccinated.
say your age.
So I think,
How would they know if I don't?
yeah, I think the national program on immunization is doing a fantastic job on
Okay.
that. So most children,
Have
I would say
grown
more than
immunity.
90% of
Okay,
children
okay.
got the childhood vaccine. But that is not exactly, that doesn't exactly cover to adults.
To adults,
So you
yeah.
have to take preventive measures
Okay.
to prevent
Yeah.
exposure.
Once again, thank you very much, Doctor.
Yeah, you're
Thank you.
welcome.
Doctor, thank you.